Good afternoon. Oops. There we go. Good afternoon. Thank y'all for being patient with us. You know, we're all running fast. I know you all are too. So thank you for understanding that it just took some of us a few minutes to get here, and we may have a few more people show up soon, I hope. So let me call to order today's Appropriations Human Resources Subcommittee meeting. And before we get started, I want to ask Vice Chairman Mathiak, actually Vice Chairman of this committee, but Chairman Mathiak, to begin with a word of prayer.
Thank you, Chair Lady. If you'll bow all your heads. Thank you, dear Father, for this great day that you have given us. Father, we just ask you to help us be mindful of what is pleasing to you and how we can serve and continue to serve this great state. In Jesus' name, amen.
Amen. Okay, thank y'all for moving into place and helping us get going here. I know it's an afternoon when many people want to get away from the Capitol as soon as they can. So let's see what we can do. I want to remind everyone there is a sign-up sheet at the back. If you wish to make public comment after our speakers, we will do that today. And if you wish to wait, next Wednesday we'll also be having another meeting, and we'll include public comment there as well. So let's get started with the Department of Human Resources and Commissioner Broach. Oh, we have a question, I think. Just a minute.
Madam
Yes.
Chair, I want to apologize. I'm going to be having to step out about a DOT election and some other business. I apologize for that. I would like us, maybe if it's appropriate in your mind, next Wednesday, to have some information about what kind of audits the state provides directly to the legislature on certain questions we might ask. I'm going to ask the commissioner what she thinks an audit should look like, and I wanted to just highlight that because I might have to step out. I'm interested in us having a discussion maybe next week or at your convenience, if you wish. What are we really looking for and what might be helpful?
Okay, great. Thank you. Great question. And so are you going to ask the commissioner offline that information, or you want to, would it be okay if we start with that and then we'll go right into your testimony as planned, since Representative Oliver does have to step away? Yeah, okay.
Can you hear me okay?
Yeah.
I should know this and I don't know this, and that's why I'd like to educate myself. Routinely you have audits internally.
Mm-hmm.
And routinely you have audits from the federal oversight, which I think
can hear you.
Thank you. Routinely you have audits internally, and routinely I think you additionally have additional audits from the federal system over. The State Office of Audit and Accounting, does that do an audit without us asking, or what kind of audits do you think are most helpful to you?
Well, are you talking about the Department of Audits?
Yes,
we
that
do
was the
engage with
last
them a
question.
lot. Yes, ma'am. So we do engage with the Department of Audits pretty regularly, different reasons across the agency. And then in terms of looking at our financing and fiscal affairs across the agency, we do across divisions look at that. We have internal processes. So, depending on what someone would consider an audit, I want to make sure I cover that topic the right way, since there's so many different definitions. Demetrius, do you want to jump in?
So Department of Audits, they do an annual audit report every state fiscal year. Okay. And in those audits, every year they identify specific program areas that they plan to audit within that given year. A lot of those programs are some of our big program areas, like SNAP, like TANF. And then they also have the cluster within our Division of Aging Services. And so they take samples within those areas. They work with our program. We extract cases. They review them. We provide feedback, and we work tandem with them. It's a team effort. Typically, when we have a state audit with Department of Audits, we meet on a weekly basis, like just an update, what's the status and so forth, until we actually close out that state fiscal year audit.
Madam Chair, that's helpful, and you could decide at your discretion whether we need to have a further discussion of what might be unusual or what is routine and what information we want to ask. I just wanted to bring that to your attention and the committee's attention, be thinking about it between us and perhaps next week.
Thank you. Thank you. Thank you. And please feel free to come and go as you need to, but we hope you'll end up being here more than you might think.
Thank you.
So, at this moment. So let's get back on track here then. Commissioner Gross.
Sure. All right, so I will go ahead and get right into a summary of the governor's recommendations for state fiscal year 2027. So you can see the governor has recommended an overall increase of a little over $81 million for workload adjustments, with a reduction of a little over $24 million for statewide adjustments, and that is for a total adjustment of $57,094,778. If you'll go ahead and go to slide 3. So I think for you, we've got all the line items up here for you for your tracking sheet. 28.2.3 for the program budget, child abuse, neglect, and prevention. The governor's recommended a reduction of $35,348. That is to reflect fiscal year 2025 collections of marriage and divorce filing fees pursuant to House Bill 511 from a few years ago for dedicated fees. Moving to child support services for that program budget, line 28.3.4, the governor has recommended $3,637,354. That's for software maintenance on the Georgia Technology Authority's mainframe. I've talked about this in prior hearings, but it's the same continued operation of the child support enforcement system that we call STARS, and we are in the process of modernizing that system to eventually move away from the mainframe. On line 28.3.5, the governor's recommended an increase in funds of $456,374 for judicial circuit contracts. That is in an effort to restore prior budget reductions. That's for child support enforcement related work. Going to the child welfare services program budget, your line 28.4.3, the governor's recommended an increase of $371,500 to facilitate a transfer of funds for community action teams. That's from out-of-home care to child welfare services, another item I've talked about in prior hearings, but that's just to align the budgets with actual expenditures for the contract. Line 28.4.4, the governor's recommended a reduction in funds of $50,000 for projected expenditures for technology for community service referrals. Going to the program budget departmental admin on line 28.6.6, the governor's recommended an increase of $5,925,437. That is a reduction in the federal administrative reimbursement amount for future SNAP operations from 50% to 25% to reflect the change in the federal state share for how we operate the program. Going to the program budget, federal eligibility benefit services, your line 28.10.5, you can see a recommendation with an increase of $40,428,968. Again, that's a reduction reflecting changes in SNAP administrative costs, in reimbursements, I'm sorry. Line 28.10.6, the governor's recommended an increase of $12 million for SNAP innovation efforts. That's part of our overall strategy to reduce the state's payment error rate. That is in line with overall objectives for compliance with federal HR 1. Going to the out-of-home care program budget, line 28.11.1, the governor has recommended an increase of $6,229,492 to reflect the transfer of funds for a commercial sexual exploitation recovery center from the Safe Harbor for Sexually Exploited Children Fund Commission to this budget, and that's to align expenditures with the program's purpose and allow us to maximize how we draw down federal funds. Line 28.11.3, the governor's recommended a reduction for one-time funds related to clothing and supplies for foster youth. Line 28.11.4, there's a recommended reduction related to one-time funds for an initiative to place foster youth closer to their biological families. Line 28.11.5, there's a recommended reduction of $371,500 to facilitate the prior mentioned transfer related to community action teams. That's, again, just to align the budget with actual expenditures. Line 28.11.6, the governor has recommended an increase of $21,294,149. And that is via an increase of $19,400,000. Sorry. I'm trying to see make sure I've got the right slide. So that is via an increase of $19,401,801 for utilization growth and a transfer of funds. I'm sorry, give me just a second. I think I've got some of these.
$1,892,348.
Yeah, okay. Okay. And now I'll cover the administratively attached entities, although I know that we've got people from the Council on Aging here. The governor's recommended on your line 28.17.2 a reduction of $56,379 for personal services. Line 28.24.1 under Safe Harbor, the governor has recommended a reduction of a little over $8 million. Again, that's to facilitate the transfer of funds for the Commercial Sexual Exploitation Recovery Center from this budget to out-of-home care to allow us to maximize federal funds drawdown. And then the last item is your line 28.24.2. The governor has recommended an increase of $2,105, and that is to reflect fiscal year 2025 collections of financial penalties from adult entertainment establishments, and that's pursuant to prior state law changes. And with that, we'd be happy to answer any of your questions.
Representative Oliver.
On page 6, 28.3.5, I'm trying to remember from last year, there was a certain number of counties that we had to restore some child support money from DHS to DeKalb County. And this 28.35, does that include some more DeKalb County money? Because I'm not sure that did everything happen that was supposed to happen last year for DeKalb?
Yes, DeKalb was the only one that came forward to ask for the request. And so DeKalb did receive a little over 190-some thousand last year. This request does not include DeKalb in the 456,000. This is to restore the other judicial circuits that back to the FY21 levels.
They have asked me a question about this recommendation, and I'll follow up with you when I figure out exactly what the last year expenditure was and they expected. But thank you.
Okay.
Are there any other questions from the committee? You got one? Okay. Chairman Mathiat.
On page 6, where we reduced funds, $50,000 for, oh, wait a minute, for out-of-home care. Tell me about that. That's when we're putting kids in foster for a short period, or what is that?
So
Tell me what that.
the particular vendor there is Unite Us. That's a closed loop referral system, and essentially there were multiple state agencies using the system. I think the plan was for there to be more of a statewide operation. And so,
But this is just the difference. Sorry. So when this line item was originally appropriated to us, I think 2023, it was put in at $3 million, but the actual contract cost ended up being $2,950,000. So this is just adjusting our budget with our actual expenditures on the contract.
Okay, thank you.
Representative Oliver?
Page 7, eligibility benefit services, 2810.5 and 2810.6. I'm trying to remember, and I don't, if this ties into the federal government's decision in relation to shifting administrative cost. I'm trying to put that together in my mind. So explain that to me, please.
it does. So for administrative costs related to running SNAP, it's been 50/50. So with passage of the federal H.R. 1, it will increase the state's share of running the program. So this reflects that.
And I
increased
assume
share.
that the states complained to the federal government, and there's a new budget cycle coming. Do you anticipate that changing for the better or for the worse, or do you have any way to predict that?
I don't know. This is just, we've been planning in accordance with what the changes reflect.
And does it relate to a error rate, or does it only just a cut of 50 to 25%?
This particular change reflects the change in cost sharing only for the administrative cost of running the program. You can see right below it, though, the $12 million, that is additional funds for a different provision of that bill, which would be focused on the state trying to lower the overall payment error rate.
Okay, talk to me a little bit about that. It assumes that there's an error rate if we've got money in here. Is
Every
that
state, yes, has an ongoing tracking mechanism for overpayments and underpayments for SNAP cases. And so states have to hit target rates, which will then determine their cost-sharing obligation in the future, even though right now, and it always has been the case, that all of those benefits have been 100% federally funded. So this money will be used then to help us get our payment error rate down.
So the 28.6 may or may not relate to the federal government's finding of a Georgia error rate specifically.
I'm sorry, can you repeat that?
I'm trying to figure out if 28.10.6 specifically relates to a error rate that the feds have decided Georgia must be sanctioned for.
Every state has an error rate, always.
Every state has
ongoing, yes.
But it's different for every state.
Well, it always fluctuates. You want to take a stab? I can see.
Ma'am, so the amount
Tell us who you
proposed
are,
in...
please.
Sorry, Chris Apsey, Candace's Chief of Staff, Commissioner Bros's Chief of Staff.
Thank you.
So 20.10.6 reflects the state's effort to reduce our payment error rate in advance of a potential penalty being assessed. So it has nothing to do with paying the penalty. It is trying to avoid one altogether.
Okay. And are we on to penalties now?
No, ma'am, not currently.
Okay. Thank you.
Representative Cameron?
Thank you. Thank you, Commissioner. Do you know how much we pay the vendor who administers SNAP? I got the conduit, whatever their name is.
I don't have it off the top of my head, but we do definitely.
Can you just give me that
It's
number?
It's a few million dollars per year.
Ma'am?
I think it's about $7 million a year.
Okay. All right. Thank you.
Representative Glaze?
Thank you, Chairman Lady. I am looking at 28-11.3 and 28-11-4, and the elimination of essential clothes and supplies. How are we going to then make up this in the life of the foster family if we don't provide clothing and supplies?
So we still have in our base budget built in, we have annual clothing allowances, and I can't remember, it's been in recent years that you funded an increase in that amount. So this was just one-time increases for specific, I think, entities, but we we still have built
We
into
still
our
have it.
budget. Yes.
Okay, so the basics. And then tell me about the one-time funding. And I do want to say something about the placing foster youth closer to their biological families. From what I understand, if there is proximity, there is a greater percentage that they will end up back reunited with their family, and that reduces days. So sounds like that reduces the amount of money too that we would pay if they stayed in care longer. Can you speak to that?
Yes. So for the first one, is it Bloom or Youth? Was the
And then the other one was Kids Cup.
Bloom Closet and Kids Cup were the entities that got the one-time funding for line item 28.11.3. And then for 28.11.4, for that particular initiative, we did not implement it, and that is because of what we have saw in our projected deficit for that particular program budget. But I also wanted to mention that it is our practice that we're always going to try to make sure that a child is placed as close as possible to their home community, to their biological family. So typically what we see is that if we can find a DFACS home, that's usually going to be closer. Sometimes we find that a CPA or child placing agency home is further away. If it's further away, then that means that we have probably higher costs in transportation and other ancillary costs. But ultimately, we did not implement this particular initiative.
So I do want to ask, how much did we allow for Bloom? 'Cause I thought it was much less, like about 50,000.
Yeah, it was split 50-50 between the two nonprofits.
Okay. And they use 100% of the 150.
They're still, I'm sorry. My name is Melissa. I'm the CFO for DFACS, Melissa Barwick. They're currently providing services and being reimbursed monthly. So yeah, we'll continue to, as they bill us, pay them through the end of this state fiscal year.
So do you anticipate that we'll use the full amount? Thank you.
Chairman Mathiak. When?
I'm going to waive right now.
Okay. Any other questions or comments? Well, I'll just say that, I think there is great focus here on the SNAP benefit and trying to address the error rate, and seeing that. So, what are the ways that y'all are actually using to reduce that SNAP error rate right now? I know it sounds, and you say all states have it, but it sounds like, is there something we can do to change that? So what are y'all doing right now?
So compared to the other programs that we administer in the Georgia Gateway system, SNAP is uniquely manual, work intensive, and person intensive, and that's a unique challenge for us because it means that we're not able to get permission from federal regulators to automate as much of the process. And so when you can't automate as much of the process, then you're more prone to have sort of human error injected into the process. We're hoping that through submission of different waivers, that may change, or that we'll get federal guidance that will come down. We've been told that hopefully that will happen, where states will be afforded more flexibility related to automation or contracting out some of the eligibility work. We prefer to use automation if we can. So we've submitted waivers. Some of those have been denied. We still have some pending. We've implemented other changes to the process, like intelligent task routing. So making sure that when we're sending work to one of our workers, that it's in the right format, it's what they can handle, that we're tracking it appropriately, they're getting the right help from supervisors. We've been doing targeted training. We've put together a one-pager. I think that would be helpful that we can circulate. We also are doing intelligent analytics on the back end. So we're we're working through a SNAP fraud grant that we were recently awarded, and working with SAS, where if we identify sort of flags in certain cases when they're compared to others in the overall caseload of SNAP and pull them out for additional review, we can fix those errors within a certain time frame, and then it won't count against us in calculation of the payment error rate, which is great. We also can keep doing that kind of analysis later, and if we pull them out because we suspect or we actually detect fraud, then when later we're trying to work toward calculation of the payment error rate, then that also would not be used against us because we're actually going after that potential fraud. So there's a long laundry list. I know I'm probably not doing it justice if there's anything you wanted to add to that, but we're trying to look at it multifaceted, but ultimately we're really hoping that we can get additional flexibility to automate more of the process.
And you said other states need that as well? I mean, this is the way that everybody has to go through the
Yes.
system?
I think it's only actually a handful of states that have an error rate below 6%, which is what you would have to avoid any cost-sharing obligation that the federal H.R. 1 bill would impose on states. I think the average national payment error rate is right under 11%. Yeah.
So the federal government recognizes that humans do a lot of the work and people make mistakes. And so the acceptable payment error rate is 6%. Anything above 6% is deemed, needs improvement. Over the past 4 years, during the COVID public health emergency, they suspended the payment error rate process. So we don't have data from those 2 years, but over the past 4 years, the national average has been between 12 and 10%. So I think last year it was maybe 10.5% was the national average. So every state, has a process where they review their casework, and as the commissioner stated, I think all but maybe 4 or 5 states are above that 6% threshold.
Below, yeah.
Or their payment error rate is higher than 6%. So it's not a Georgia-specific situation. Everyone's struggling to meet that federal benchmark. And I'm John Holman. I'm the Deputy Commissioner here at the Department of Human Services over the Office of Family Independence that administers the SNAP program.
Thank you. Representative Glaze.
I'm sorry, I just want to circle back around one more time. And I understood that Bloom was actually supporting in the clothing area, not charging you guys after they give you guys the clothes for the kids. So help me understand how that's working.
Right. So my understanding is that it is a nonprofit entity, and they do have pretty robust fundraising, but they did secure this line item, and so we wanted to fund it appropriately, given that they provide support to our children.
We're not paying for the totality of the clothes that Bloom Closet provides to children in our care, just the amount that was appropriated to us. We split that $150,000 over 12 months, and they are able to get reimbursed at least that amount from our contract with them.
So I'm just going to say this. I'm not understanding how we're giving money to them to buy the clothes, and then we're taking it out of our budget, and yet the kids are getting the clothes. Is it not where we could just have the money available for the kids to have the clothes? Why is it going through the third party? And I don't think 100% is coming back, is it?
So our usual process is that the children receive, the foster parents for the child will receive both an initial clothing allowance for when the child comes into care, just to make sure that they have, the appropriate clothing. They, may have left their parents' home without very much with them. And then we also do an annual clothing allowance, and that is just reimbursed directly to the foster parent. So the foster parent will go and buy clothes, beginning of the school year like everyone else, and then submits to us for reimbursement. So how I understand Bloom Closet and Kids Cup is they provide above and beyond, right? So if kids want more clothes, different clothes, they're able to support that way, but we don't generally contract with them as a necessity for our children's clothing allowances and needs. Does that answer?
I hope that there's someone from Bloom that we could talk to a little bit more. Thank you.
Representative Glaze, I think they will be here, if not today, next Wednesday. I have visited with them in my office. I have a Bloom Closet in Rome, so it was, I think, their second site that they opened up. And it is all donation. I mean, there are donations that are received there of very good clothing, and then it is given away. So it is given, and it is, it's like, I mean, I know that the clothing allowance is small. We worked here in the House, particularly initiated a bit of an increase to it a few years ago, but it is not what a parent would be able to have to fund their child's clothing usually. And I don't mean an exorbitant funding, but just shoes are expensive. I want to say, are we about $600? I should know that. I can't. It is a very surprisingly low amount when you think about someone raising a child and that's their allowance for clothing. So Bloom comes on, and they are trying to do it in other places, as are some people who are nonprofits that are not under our state umbrella. Kids Cup is in Dublin, I believe, and they are doing the same thing. They are trying to augment that challenge of having a child who has already gone through stress and trauma feel well clothed and comfortable and appropriate. So I think that's their mission, but they will be here to explain more again like they did last year. So, okay, and then I believe Representative Cameron.
Oh, boy. Had one other question, the error rate triggered. Does the federal government hold things against you, like when, I think what happened the end of July, early August, like the 45,000, 50,000 people, whatever, do they count that against your error rate?
The 45 or 50?
Like the people that got hacked, like conduits.
Okay, so circling back to conduits. So
Yeah.
the base amount for that contract is a little over 3.1 million. I
Okay.
said 7. Now, that is, I think, when we're talking about, we do have to we pay them for changes that we make to the system throughout the year. So,
Okay.
for if people have their benefits stolen, under federal regulations, ultimately the state is on the hook for stolen benefits if it's determined that inadequate security measures did not exist.
Okay.
I don't know of a circumstance yet where the federal government has come back and told us that we have to pay back the total amount, but that is technically in federal regulations, and so the state has delegated that authority to Conduent. The state has an indemnification clause with Conduent's contract, and so should that happen, I guess that's the mechanism that we would pursue.
All right. Thank you very much for your time.
So I've just got any other questions right now, and if y'all think of them, don't hesitate. Oh, we've got one. Representative Glaze.
I understood the error rate you gave was the national rate. You didn't give the Georgia rate. Do you want to share that?
Yes, the most recent Georgia payment error rate is about 15.5%. Now, we did make, under the prior administration, timeliness was really the push. And I neglected to mention this earlier, and I thought of it whenever John was talking. Timeliness was the push, and we were struggling with timeliness. And so what we did was we adopted the process called periodic reporting. And what it does is it means that people that are on SNAP, instead of having to provide as much paperwork, essentially, more often we ask them whether they've had any changes, and they can say no. Now, if they say that, but it's not true, and then later, whenever our payment error rate is being calculated, and let's say one of those cases is included in the sample, then that error actually has a more punitive effect than an other error, like a regular error. And so periodic reporting, that adoption of that process in particular, has had a dramatic negative effect on our overall payment error rate. We are going to roll back that process, which we're trying to figure out now. And we think that will make a big change. That alone will we think, reduce our payment error rate, plus the other strategies that we're deploying.
Well,
Did I
it
miss
sounds
anything?
really good that
It
you've got
does.
a resolution for the issue that's really giving you such a high error rate. So thank you for sharing what the resolution you're going to roll back and not have as many requests for changes, and that's going to help reduce that rate. Thank you.
Thank you. So I have a couple of questions, but if anyone else has any pop up as we talk, please join in. So, when we met on the amended, we were dealing with a lot of things there, but I would say we were also dealing with the availability of services and placements since those services were frozen as a result of the deficit. Have you seen impact from that since we last spoke? Are you seeing some needs? That's what we're here to do, is try to figure out what the needs are and what we can try to help with.
So as part of our deficit reduction strategy, there were certain contracts that we terminated, and then we also changed the process for how we authorize services. And so for the service authorization process, we implemented additional regional and state level review. And what that means is, for us, we would look at the case, we'd look at, where the case is at in the process, if a parent is being compliant with their case plan, what's being requested. Essentially, we're trying to look at the necessity of the service before it gets authorized, and if there's some alternative funding mechanism so that we're best leveraging all of our resources instead of going straight to DFACS funds. It's been a very illuminating process for us, and I think that it will certainly inform ways that we can make changes to policy over the summer. It's definitely informing some ways that we can make changes to our contracts. We're looking forward to the study committee process if that occurs, and we want to make sure that we are taking full advantage of existing programs in other agencies in particular. One thing that we weren't doing, and we certainly should, is we should be trying, if we can, if a parent needs services because they are low income, we should be trying to see if they're eligible for Medicaid. We should be trying to get them to, their local CSB or FQHC. Those things weren't necessarily built into our process, so we are trying to do that now. And that has been incredibly helpful from this change in the process. Now, it means, though, that from working with courts, we still have a lot of work to do. And that I'm working on some materials that we can provide, and some additional back and forth. But in our opinion, we are doing our best to serve these children. I do think, though, that, it's always a possibility that some things are not reaching us, and that's why we set up a dedicated inbox where people can send us things, so I can look at them myself. It's integrity@dhs.ga.gov. I want to make sure that we're doing our best in this current situation. I know that we're currently crunching the numbers to see where we're at, what the deficit reduction looks like now, and so as soon as we have new numbers, then we can provide those to you.
Okay, that'll be good. So I think another concern that I've heard, what are some ways that the House can support your efforts to streamline the process for reporting child maltreatment? I know it's a challenge. We hear it from mandated reporters frequently. So what can we do to help with that?
So our case management system itself, Shines, is quite old. And so anything that we can do to make that system more user-friendly and nimble is going to be helpful, so that a case manager is not spending too much time putting blocks of text into the system, that information is useful, that the system talks to other systems well. And right now, that system just doesn't perform those functions very, very well. we know that we have external partners that would like to see more interactions. Law enforcement, judges, our attorneys would like to see more functionality available to them. So that's something we'd like to see some investments in. At the end of the day, we want to make Shines not necessarily tailored towards specific external systems, though. We want to make it so that it's nimble enough so it can be tailored to work with really any external system, because everything changes so quickly.
So do you feel that Shines is something we need to build on and keep doing that, or do you feel like it would be better to have something new or different?
I mean,
don't know.
there's so much new technology that we've modernized Shines to the extent that we think it's working well for now, but we'd like to replace the system.
Yeah, I just want to make sure. We ask you that, I know,
Yes.
all the time, but
Yes.
will. Hopefully I don't have to continue to ask it. I hope one day it will be
Yes.
done. Okay. Yes, Jeff got a question?
Real quick,
I mean-
just speaking on that, so you really need a system where different partners around the state, you could all use the same system. Maybe you have different security levels, but you have, because I come out of the health insurance industry, so we had facets, the Trizetto product, and you have different parts that, your people can load blocks of information in and not have to, and then other people can access just inquiry, those kind of things. Is that what you're talking about?
Exactly.
Okay, thank you.
On another note, just curious, how's the hoteling situation? Are we still keeping kids in better placements than that right now?
Yes, we are. So we were, years ago now, although it feels like yesterday, going, on average, any given night, it was between 60 to 90 children that were either in a hotel or a DFACS office. And once we, really focused on getting that number down and ending our reliance on it, we've stayed pretty consistently in the single digits or the teens ever since. And so when we're in that, even when we have children being hoteled, it's typically because we're waiting for a mental health bed. Or we have a child that has got complex needs, they may have pending charges, they may be very medically fragile, something like that. And so we're trying to find a very specialized home for them, which we have a shortage of, but those are the circumstances where there's nothing available right then. But typically it is because we can't find a mental health bed.
So there are still some. Kind of, what are the numbers? I'm not going to hold you to a specific, I know it
I would
varies
say
from
the
day to
average
day.
is going to be, 9 or 10
A day.
a day
Pretty much, all across the whole state.
for the entire state.
Yeah. Well,
And that's I would say, out of those 7 or 8, it's because they need a mental health bed. They need a psychiatric residential treatment facility, and there are no beds.
And are those placements in a hotel usually, are they short right now? Or are we seeing them, or are we having, they're not. They're long extended stays at sometimes.
Yes, because there aren't enough beds for those children.
Yeah, okay. Okay, well, I know you've worked hard on it. Certainly those are much better numbers, so something to be grateful for.
Yes, absolutely.
Yeah. Okay, are there any other questions or comments from the committee? Not seeing any. Are there any other things y'all would like to add? You or any of your staff that are here?
Just thank you for your significant support of the agency. I mean, that doesn't do it justice, but thank you.
Well, thank you.
Our staff have noticed. They watch all of these hearings, so
I know.
thank you.
A lot of people watch them. Thank you so much. Good to have you all here today. And if we have any other questions, we'll be back in touch as we get ready to tackle a great big budget.
Yes.
So, yeah. Thank you. All right. So next, we are going to hear from the Council on Aging. And I think Amber's going to help y'all get set up. When y'all get ready, just introduce yourself and tell us a little about you.
Alrighty. Good morning. My name is Ashley Burton. I am the Deputy Director for Georgia Council on Aging. And to my left, we have Eve Anthony, who is a council member for Georgia Council on Aging and our co-age chair. So thank you, Chairman Dempsey, for this opportunity, along with committee members, to speak with you about Georgia Council on Aging today. Today we'll briefly introduce Georgia Council on Aging and our co-age perennial budget issue, which is non-Medicaid funding for non-Medicaid home and community-based services. So this slide shows just a bit about who we are. Georgia Council on Aging was created by the General Assembly in 1977 to represent and address the needs of older Georgians. Our council is appointed by the governor, lieutenant governor, speaker of the House, and the commissioner of DHS, Department of Human Services. The council can have up to 20 members, including consumers and service providers, chosen to represent all older Georgians, including rural, urban, minority, and low-income communities. The representation allows us to bring real statewide perspectives and needs to the General Assembly. So this is just our small but mighty staff. We currently have a team of 3, and we support the full scope of the council's work across the state. Yesterday, you may have seen our annual senior day at the Capitol that we planned and hosted with the support of our council members and volunteers, welcoming over 400 adults and advocates from across Georgia. Senior Day brings older Georgians directly to the Capitol to engage with you all, learn about civic engagement, and advocate for issues that impact their lives. So with our small team and dedicated council members and volunteers, we were able to provide a memorable and meaningful experience for seniors across Georgia. And a little bit about our mission and what we do. The council serves in an advisory role to the state leadership, governor and the General Assembly, and state agencies on aging issues. Our work focuses on 3 core areas: advising and making recommendations, advocating for older adults and their families, and educating communities and decision makers. Our advocacy includes recommending legislation, presenting testimony, and training advocates across Georgia. We also provide leadership to the Coalition of Advocates for Georgia's Elderly, also known as COAGE. COAGE is our statewide coalition led by GCOA. It brings together organizations, providers, advocates, and consumers to identify and address the needs of older Georgians. It serves as a unified voice, emphasizing the importance of supportive communities and access to services. One of the coalition's longstanding priorities is, again, one that we're going to talk about today, which is the funding request for non-Medicaid home and community-based services. I'd like to also acknowledge the governor's 2027 budget recommendations for the council, which is a reduction of $20,815 related to the changes in employer benefit contribution rates, and a disregard of the $56,379 for a total reduction of $77,194 in the fiscal year 2027 budget for personal services. And now we will have Eve Anthony to present on our co-age perennial budget issue, non-Medicaid home and community-based services.
Thank you. Good afternoon, Chairman Dempsey, committee. Thank you so much for the opportunity to be here this afternoon. So in addition to serving as a member of the Georgia Council on Aging, I also serve as the president and CEO of the Athens Community Council on Aging. And we're a private nonprofit organization. We provide home and community-based services and other aging services to 14,000 seniors in Northeast Georgia. So a few months ago, I had the privilege of celebrating 25 years in my role at the Athens Community Council on Aging. And over those 25 years, I've seen a lot of change. We have a growing number of seniors in our region. We have more vibrant and active seniors. And then we've also seen a lot of meaningful innovation about the way that the work is done. What I haven't seen change, unfortunately, in the 25 years that I've been in my role is the waiting list for home and community-based services. And so over this time, what I've come to understand is that these waiting lists are not a program problem. Our programs are effective. What they are an investment problem. And so today I'm respectfully requesting an additional $2.5 million in FY27 funding for home and community-based services. And these services include in-home personal care support, adult day health for individuals living with dementia, caregiver support, Meals on Wheels, and other related programs. And these are the essential services that allow older Georgians to remain safely and independently in their homes and in their communities. Georgia currently serves 28,647 of our older neighbors through HCBS. And at the same time, there are 9,070 eligible vetted seniors on our waiting lists. Of those, most of them are waiting for Meals on Wheels. So that's approximately 4,300 of our older neighbors in our communities, followed by homemaker or in-home personal support services, and that's a little bit over 4,200 seniors. Based on the average annual HCBS cost of $2,700 per client, this $2.5 million investment would allow approximately 915 seniors to be removed from that current waiting list. Georgia's population aged 60 and older now exceeds 2.5 million people, so that's roughly 1 in 5 Georgians, and it's projected to grow by more than 70,000 additional older adults in 2027 alone. Nationally, adults aged 65 and older will outnumber children aged 18 and younger by 2034, and we're already seeing that shift in many of the rural communities in Georgia. Yet funding for these critical support services has not increased at that same pace. And as I was preparing for my remarks today, I looked back at my notes from a similar presentation I gave in 2023. And at that time, approximately 6,000 seniors were waiting for home and community-based services. So today, more than 9,000 are waiting. So that's an increase of 3,000 people in just 3 years. And that growth is not the result of inefficiency. It is a result of demographic reality outpacing funding. And so when demand increases and the funding does not, that pressure doesn't disappear, it just shifts. And so it shifts into emergency rooms, into hospitals, and long-term care facilities. Research consistently shows that HCBS programs reduce hospitalizations, prevents emergency room utilization, delays premature nursing home placement, and supports caregiver stability. On average, these services delay nursing home placement by approximately 4 years. And the impact of these services is reflected not only in stability for families, but in reduced public expenditures. That fiscal comparison is pretty clear. The average annual cost of HCBS, like I mentioned earlier, is approximately $2,700 per person. By comparison, the average annual cost of nursing home care in Georgia is approximately $80,000 per person. And so for a modest investment of $2,700 annually, the state can help avoid or significantly delay an $80,000 Medicaid expenditure. And so this isn't simply compassionate policy, it's cost avoidance. But truly, behind every line item is a family just trying to hold things together. And so several years ago, I had the honor to meet the Thomases. Mrs. Thomas was referred to our adult day health program at the Council on Aging by her husband's neurologist. She needed support to care for her husband, who was living with dementia. And over the last several years, we've gotten to know both of them very well. So Mr. Thomas, he's living with early stage dementia, and Mrs. Thomas really is devoted to him. But before Adult Day Health, she came to us and she said, I'm exhausted. At 78 years old, she was managing his medications, supervising often challenging behaviors, meals, and personal care entirely on her own. So like so many caregivers that we know, she loved him deeply, but she was running out of strength, and her concerns and her ability to care for him at home were real. Through HCBS-funded Adult Day Health, Mr. Thomas now attends our programming 3 days a week. He receives medical monitoring from nurses on our staff, structured cognitive activities, therapeutic engagement, and also nutritious meals. And just as importantly, Mrs. Thomas receives reliable respite care and time to attend to her own health, her doctor's appointment, church Bible studies, and the ability to recharge. And so those outcomes are clear. What we see for Mr. Thomas is he remains at home with his wife, truly where they both want him to be. Ms. Thomas remains healthy enough to continue the caregiving. There have been no preventable emergency room visits, and there's no premature nursing home placement. And so without this support, Mr. Thomas likely would have required nursing home care at a cost substantially higher to the state. Yesterday, I had the honor of joining seniors from Athens for Senior Day at the Capitol. And in our meetings with our local delegation, one theme emerged repeatedly, and that was the rising costs of living. Property taxes, insurance premiums, utilities, and groceries are placing real strains on our older neighbors. And the fear of outliving one's resources is real. HCBS has long functioned as Georgia's safety net for older adults. Modest, targeted investments that prevent far more expensive consequences. But safety nets require reinforcement. Without reinforcement, that safety net weakens, the waiting list continues to grow, and costs rise in other parts of the system. So on behalf of the Georgia Council on Aging, I respectfully ask that you include an additional $2.5 million for home and community-based services in the FY27 budget. And truly, thank you all so very much for your time, for your leadership, and your unwavering support of Georgia's seniors. I'm happy to take any questions.
Thank you. Thank you. Great information, too, for us to have here. So I think first is Representative Cameron.
Thank you, Madam Chairman. Thank you for your testimony. I'm a former caregiver, and these kind of services back in those days really weren't available. So the investment of $2.5 million saves a lot of money, but it also saves a lot of wear and tear on people. You offer some of the same services or similar services like a PACE program offers, but not complete. Would that be correct?
That's correct. So PACE program, I believe, is a Medicaid-funded home and community-based service model. So we offer similar services. Eligibility is different, and often these HCBS services supplement where Medicaid eligibility cannot.
So probably a lot of the caregivers you're saving that are exhausted, excuse me, but are worn out, you run across this pretty regularly, do you not?
We do. Often we work very, very closely with our healthcare providers in our community, often with neurologists, and they see us, the programs we provide as saving grace. There's only so much that you can do as a physician to help people living with dementia. They have 15 minutes, and then after that, the care is provided in the community. But for so many families, that care isn't accessible because they can't afford it. And so, providing private pay home care, provide private pay nutrition in the home, having someone come into the home without simple tasks as bathing and other services, most caregivers without some sort of support, financial support, just don't have, it's not an accessible option.
It sounds like you do a great job. Thank you.
Yeah, thank you.
Thank you. Chairman Mathiat.
Thank you, Chair Lady. I'm so excited that you guys are here.
Thank you.
I live in Griffin, so I'm in the Three Rivers area,
Okay.
Council on Aging. Give us an idea, because I understand what Representative Cameron talks about with caregiving, and it's the caregiver that usually suffers. They're the ones that they're ever ready bunny. Batteries don't last long. Give the committee an idea of reimbursement, because every senior wants to stay in their home. And you talked about 3 days, which is Yahoo, at least we've got a little bit. Give us an idea of what the reimbursement is for the caregiver that comes in to help. And then once we hear that, I want to compare it to what happens in the foster care child system.
So, looking at statewide, the average cost of a home and community-based service, so the services that they provide, is $2,730. Now, that fluctuates based on the type of service. So, for example, and I don't know what the state averages are, but I could tell you what that reimbursement rate is for us at my organization. So, for example, a home-delivered meals is $12 a day at Adult Day House Center, where you have nursing supervision, a meal. You also have physical occupational therapists on staff available. That day is about $120 reimbursement. So if someone, for example, was coming 5 days a week, that reimbursement would be over $2,000. Now, for HCBS funded programs, we don't offer 5 days a week so
Right.
that we can share the care with others.
And it's usually 3 days, correct? Or
Depending, 3 is maximum.
two.
It's 2 or 3.
Okay, I thought it was 3. I'm sorry.
Now others, again, I'm just telling what it is at our organization, but others may, but for our organization, 3 days is maximum.
Thank you. Appreciate it. Thank you, Chair Lady.
Are there any other questions or comments? I'm not seeing any, but let me see here just a minute. So, we have tried, and y'all, I know y'all are aware that we do try to come in and add some money every year, what we can find.
Yeah, thank you.
To do that, and we'll continue to do that, I'm sure, do our best. What have you seen from some of those previous investments that the state has made for non-Medicaid home and community-based waiver slots? What are you seeing?
So waiver slots would be for Medicaid or for this pot of dollars?
For the non-Medicaid.
Okay, so that would have been waiting list numbers. Do you have those?
Yes, so for fiscal year 26, about approximately 28,647 clients were served through December 2025. So that was this year, fiscal year so far, those amount of clients have been served through non-Medicaid home and community-based services. I don't have how many cases were removed from the wait list on hand, but I can definitely get that information and provide it.
That would just be great for us to reflect upon.
Yes.
I'm sure it's not enough, but it would be good to kind of take a look at that.
And what we do see happens is, yes, people are removed with the funding that's added, but because the need is growing, the list continues to grow as well.
I know. I know.
Yeah,
So,
But we are grateful, as she said. Thank you.
Yeah, I know you are.
Yes.
So, Ms. Burton, I know, we all, for years, heard from Deborah Stokes. Are you that position
So
today?
no, I was in the interim, but actually on Monday we have our new executive director was appointed by the governor, and he'll be starting on Monday. His name is Daniel Regenstein.
Oh, great.
He is currently the chief of staff for DOAS, but he'll be starting with Georgia Council on Aging on Monday. He'll be getting sworn in, so we're excited to
Okay.
welcome him to the team.
That's great. Will that
Yes.
mean that you step back
I will
into
to the deputy role,
You'll-
yes.
Yeah.
But you can always call on me for whatever you need, and I'll
That's
be there to
great.
support the ED as well as you all.
Well, you're doing great work, and we appreciate it. And I look
Thank
forward
you.
to meeting him. I don't
Yes.
know if he might be around next Wednesday when we do the next hearing, but if he is, he's certainly welcome to stop by and
Sure.
give the committee a moment to meet him as
Okay,
well.
great. I'll definitely let him know.
That would be great.
Yes.
That would be great. I'm not seeing any other questions. Y'all did a great job and a great
you.
presentation.
Thank
We
you.
appreciate you so much.
Yeah, thank you. We
Same.
appreciate
Thank
Very
you so
important
much.
work.
Okay.
Without a doubt. So there is a sign-up sheet. Like I said, if you haven't signed up and you would like to speak, we'll try to check that and see and begin to have some public comment this afternoon on this or any of the other issues that fall under the purview of this subcommittee. Okay, so let's see. First is Sheila Hummerstone. talk about MemoryNet a little bit, I bet. I hope. Yes, you can, sure. And y'all are welcome to be at the table or wherever you'd like to be. Good to see y'all this afternoon.
Good to see you. Good afternoon, Madam Chair, members of the committee. My name is Sheila Humberstone with Stonebridge Consulting, and I am privileged to be with you all today and here to introduce Georgia MemoryNet to many of you. It has been the privilege of my life and the honor of my life to represent these individuals. I want to thank you all and your colleagues in the House and Senate over the last few years for investing in Georgia MemoryNet. It is the most incredible program. I'm so excited to be able to report its progress and our vision for the future. As many of you know, Emory University is the only NIH-designated Alzheimer's disease research center in Georgia. I think the only one in the Southeast, or one of very few in the Southeast, world-renowned. And it is the research that is done at Emory that, through what those lessons learned are, that we've been able to bring that research from a translational perspective to all corners of Georgia. So we're going to talk to you about sort of what GMN is, a little bit about the research and what, you know, when we started GMN, it was in recognition that the medications that were going to be available would only work if they were given at the various earliest stages of the disease, right? And so you're going to hear what we're finding now about what the current state of research is and what now is on the horizon for prevention. So I'm going to introduce our fearless leader, Dr. Law, who, whenever we expand and whenever we do more, he jumps at the opportunity to continue moving us forward.
Good afternoon, Madam Chairwoman, and the committee members, and thank you, Sheila. Without Sheila Humberstone, really, this program would not even exist. So she says all these nice things about us, but it's really her and her passion that has helped to drive this into reality. And what I'm going to talk to you about is actually not research, and I'm incredibly grateful to be able to say that after doing this for almost 30 years. And the handouts that you just received, what it shows in the upper left-hand corner image is a human brain, or a series of human brains that have evidence of Alzheimer's pathology. And what you're seeing in those images, going from left to right, in people who have been treated with some of these newer drugs, is the literal elimination of Alzheimer's pathology out of the brain, literally cleared out of the brain so it becomes undetectable. And what's really important about that is the plot below that, which is not a real plot. It's a hypothetical plot. One of the most common questions we get from the community is, what's the difference between Alzheimer's and dementia? And people hear Alzheimer's and they tend to imagine somebody who's in memory care or skilled nursing, debilitated, incapacitated. That's the end stages of any dementia, whether it's Alzheimer's or some other disease causing that problem. Alzheimer's disease just happens to be the most common cause in older adults. And Alzheimer's disease also is silent for 15 to 20 years. So that pathology that you're seeing in that upper left-hand picture may be evolving silently for 15 to 20 years before somebody actually develops the first symptoms of memory loss. And at that stage, people may still be running businesses, winding down medical or legal practices, serving in the House or Senate at that stage. The problem is it doesn't stay at that stage, and it progresses. And over time, over the course of 6, 8, 10, 12, 15 years, it can be devastating. And what you're seeing on that hypothetical plot is the data from some of the studies that have shown now removing that Alzheimer's amyloid will significantly slow the course of progression. And the slowing in the studies, in these 18-month studies, is typically cited as 25 to 30%, but those are over 18 months. And Alzheimer's disease is not an 18-month disease. And so the expectation and the reality that we're seeing now is that over time that slowing continues. And when I tell my patients that the prospect now with these drugs is that by slowing things down, I'm not going to turn it around or fix it, but I'm going to give you a much better chance of getting run over by a bus before you wind up in memory care or skilled nursing, and nobody has objected to that, not one. And that's where we are today, and that is on a foundation of research over the last 3 decades. And what you're seeing on the right-hand side of that is some preliminary data from about 350 or so patients so far at Emory that we have treated with these newer drugs. And what we're seeing is that a substantial proportion of them appear to be progressing slower than we would normally have expected over time. And so I give you that as background for Georgia MemoryNet, because we anticipated that this day would come. And when we were talking to former Chair Terry England of the House and other leaders and advocates, we knew that this was coming, but we weren't ready as a state. And one of the things that we said we needed was we needed to be able to accurately identify specific causes of disease. And one of the promises that we made was that we would set up a network statewide so that people could get access to accurate diagnosis early, within an hour's drive of where they live. And that was the genesis of the Georgia MemoryNet, which started as the Georgia Alzheimer's Project. And as Sheila alluded to, the day that I heard that it was actually signed by Governor Deal, my response was, oh, expletive, because I knew it was going to be a tremendous amount of work to get this set up. And but it has been a labor of love for all of us. And we have now set up these diagnostic clinics, and we think that it has brought this care, this diagnosis and care, to all regions of the state. You know, we think about a lot of disparities, and we don't like any of them, but one of the major disparities for our state and for other states is geographical disparity. And people in rural Georgia, Terry told us one day that a lot of people he knows have no intention of ever driving to Atlanta in their whole lives. They're terrified. And so those people weren't going to get access to our expertise, and now they can through Georgia MemoryNet. And coming in the future, and I'm going to let Rebecca tell you about some of the benefits already, but what is around the corner now is prevention. I told you that people have this disease evolving for 15 to 20 years before they have symptoms. We can identify that before the symptoms emerge. And logic is, don't wait until people get sick. Figure out how to predict who's going to need treatment and deliver it. And that's going to be the next stage of Georgia MemoryNet's evolution. So I'm going to let Rebecca take over from here.
Yeah, thanks, Dr. Law. Hi, everyone. Rebecca McIntosh. I'm the program director for Georgia MemoryNet. It's good to see you all. Seeing some of you twice this week is really wonderful. So thank you so much for your time. And as Dr. Law was saying, you know, bringing this access to early diagnosis, accurate diagnosis, and importantly, we link folks to community care as well. So whether you're eligible for some of these innovative, life-changing therapies to slow progression or not, we also want to be sure that you do have access to community services and supports. Bringing this to folks across the state is also near and dear to my heart as being born and raised in this state. These guys are my heroes for having the foresight and insight, as well as the Assembly, to have the courage and commitment to invest in this infrastructure. So where we are today, y'all see on this map, we've got 7 memory assessment clinics spread out across the state. And then we also partner with the Department of Public Health to establish assisted telehealth sites. So if somebody can't make it all the way to one of our memory assessment clinics, maybe they can't do telehealth at home, they might be able to go to their local DPH office and have an assisted telehealth visit there with our providers at the MACs. So far, since the beginning of the program, this number here, 5,798, a little bit old. That's a little bit higher just over the course of January and so far in February. But suffice to say, we've seen about 6,000 folks so far. That number year over year has been increasing pretty exponentially. I think between 18 and 2023, it was a 36% year over year increase. So we're growing rapidly. But I will say our MACs are starting to hit their capacity, right, based on what they're funded to do, the infrastructure that we have. And so seeing about 1,400 folks a year currently. As Jim had mentioned, we've got about a quarter of our folks live in rural counties. And then importantly, going with those drugs, you know, to be eligible to receive these drugs to slow the treatment or slow the progression, you need to be in those early stages. Well, we've got almost 2/3 of our folks are coming out. We see that they're in early stages. About a third have diagnosis of very mild disease, mild cognitive impairment. We're also seeing that our memory assessment clinics are referring folks to these treatments. It's important to understand that we are currently funded as a diagnostic network. We diagnose and link to community services, link back to primary care, but we don't have the funding or the infrastructure currently to help the MACs actually deliver the treatment. These drugs are very, very complex. Sometimes they can be very dangerous. They require a lot of safety monitoring, coordination, and so an investment with some additional resources to help bolster the MACs to do that and partner with local neurology clinics is going to be key so that we can ensure not just access to the diagnosis, but actually, okay, you're eligible for these drugs, let's get you on them and let's get you the support to care for you while you're on that journey. So when you start looking at how many folks our MACs have referred to treatment and the Emory, we account for about 60%, and that's a conservative estimate of how many people in Georgia are on these life-changing therapies. And then I think something of very much interest to you all as the Appropriations Committee, we're already seeing, based on some early data analysis looking at healthcare and CMS costs, that Georgia Memory Net patients are a fraction of the cost than their non-Georgia Memory Net counterparts who also have a dementia diagnosis. So looking at all costs, Medicare, private payer, out-of-pocket, GMN patients are about the third of the cost of other folks with dementia who haven't gone through this network. Yes, ma'am.
The medications that Rebecca's alluding to are incredibly costly, and even taking into account the high cost of those medications, those Georgia Memory Net patients are still saving the state dollars by being in this program.
That's right. That's right. And the hope is, too, that by extending that quality of life, we're also significantly delaying or potentially even preventing the need for skilled nursing placement, memory care placement, which obviously is a cost savings, but, none of us wants to be in skilled nursing or memory care to live out our days, and we certainly don't want that for our families and loved ones. So very important. And those last 2 pages of the handout are just kind of what we're thinking around what those needs, might be, that additional investment, the 3.3 edition being really to bolster, like I was saying, can we deliver this treatment to folks across the state? And then looking forward to the future, what's it going to take to have the foresight like we did 10 years ago, 15 years ago, to say, okay, these drugs are going to be on the market, let's build this infrastructure. We are very much right now at the point where we need to start thinking about the infrastructure for prevention. I'll let Jim weigh in.
No, I just wanted to say something that I meant to say at the outset that I forgot, is it is incredibly gratifying when I'm at other events or at national meetings for people to be just jealous, green with envy of the state of Georgia, because we have had the foresight to set this up with the state support, and nobody else has a system equal to ours. And I can tell you that we literally, Georgia is the envy of the nation when it comes to this kind of system of diagnosis and care.
Yeah, I actually was just on the phone with folks from Tennessee yesterday afternoon. The Tennessee Department of Public Health and Vanderbilt are looking to establish something modeled after Georgia Memory Net, and that's one of probably 10 different states I've talked to over the past few years. So it's really, really cool. And again, being from here, I'm just kind of proud of that as well. It's pretty neat.
So with that, we're just bringing to you the request for us to start considering and looking towards adding a treatment component and getting on the board for a prevention component at some point in the future. And the only other thing I'd like to acknowledge is Texas has invested just a massive amount of money in Alzheimer's research. They put in $3 billion
with a B.
$billion into Alzheimer's research for Texas. So we're not asking for that. We'll answer any questions and just really appreciate your time and your continued support of this program and for the patients that we serve and the families who love them.
We are so proud of y'all too. This is just, you're right. It does not exist in other places, and Ms. Humberstone was just genius, as well as being so touched by it personally. And we do, I think the greatest thing you can do is when you go through a hard situation is to figure out, okay, what can I do to help someone else not do this? Thank you. Thank you so much. Representative Cameron.
Yeah, I think you're giving us a brother-in-law deal compared to Texas.
We are.
Yeah,
It's the
that's
fun-
what we call it down south, the
That's right.
that's in Georgia. Doctor, just a couple of questions right quick. Would you agree with the characterization of Alzheimer's disease as type 3 diabetes in the sense? Or
I hate that terminology.
Okay, thank you. I just wanted to get that out.
Yeah. No, there are some biological and genetic and other linkages, but that would cause me to really nerd out and bore everybody to death. But it is not the same as diabetes type 1 or type 2. It is. It has metabolic components, but is a very distinct disease.
Okay. And I guess as the older I get, I read incessantly about preventing or slowing down aging. Dr. Sinclair at Harvard, some of those people, I read that. Is that a component to try to keep people from aging as fast by diet or whatever?
So there's something called the Lancet Commission that every few years releases a report on modifiable risk factors that can impact age-related cognitive decline and dementia. And the most recent report that came out in, I believe, 2024 really tallied up that over 40% of late-life dementia was entirely avoidable. And that's based on things like education, managing chronic health conditions and everything else, smoking, excessive alcohol, proper sleep, social isolation, depression, all of those things. But I tell people that really if you want to avoid getting Alzheimer's disease, I can tell you a secret formula. And one is be highly selective in your choice of parents. And the second is don't get old. But the don't get old part is really critical because that is the single most powerful risk factor for getting Alzheimer's disease. And everything that you can do during earlier stages of life, healthy diet, exercise, mental and social engagements, all of those things create greater resiliency in your brain against age and disease-related changes. And so those things that are becoming more in the public light and in terms of awareness about health habits and lifestyle, those are critically important for maintaining your brain's health.
Yeah, thank you for your...
Are there any other questions or comments from the committee? Well, I can just tell you, I know we're all so very grateful. It is a tragic disease that I know if it hasn't touched each of our families, it has touched someone we care about greatly. And anything we can do to move into that prevention mode, as you say, to help us stay younger and be healthier earlier in life, I'm grateful for that. I think we do have another one here, though. Chairman Mathiak.
I just had a comment. Thank you, Chair Lady. I am blessed to have somebody of your caliber to be here today, just to give us this information. I got to be in public health the other day just for a short period. So we are very grateful for Emory and you being here to do the research that your team has done and stayed consistent and stayed on point, and to make Georgia best. And that, we can't thank you enough.
Well, thank you very much. And I have to say, the level of hope and hopefulness, I've been here long enough now that I'm actually seeing, in some cases, a second generation of patients. And the hope that can be offered to them, especially if I'm identifying them early, is something that I could not offer to their mother or father. So it is a much better day today than it was 30 years ago.
Right. Thank you.
Hopefully I'm not going to be that second generation patient, though.
Well, thank y'all so much. Thank you truly for being here twice this week.
Thank you.
It's our
very
pleasure.
much.
Appreciate your time.
Thanks, y'all.
And if you have,
come into any room where we go.
Don't see what they're eating. I think is what that means. Don't see
I know
what's in
Angela
there.
well, and she has fruit in there as well.
There is. There is healthy in there a little bit.
Yes, sir. Thank you.
Okay, so next is Allie Farmer, Pace Center for Girls. So glad you're here. Give us a good update. Good to see you. Amber, I think she's got something.
Thank you. Thank you.
Big chairs.
Good afternoon. My name is Allie Farmer. I'm with PACE Center for Girls. PACE Center for Girls provides free mental health services for girls ages 11 through 17 in Macon-Bibb County. Our PACE REACH program offers social, emotional, behavioral health, and case management services. Each week, PACE clinicians provide individual, group, and family support therapy, as well as goal setting, substance abuse prevention, and intervention at schools, in the home, and in our office. Our work is centered around the individual needs of each girl that come to us. We serve 125 girls each year with individual and group therapy. We empower to strengthen relationships, develop healthy communication skills, improve emotional well-being, build adaptive and positive coping skills, and increase positive peer interactions. Some of the risk factors that our girls come with include 53% of our girls have behavioral risks, such as antisocial behavior, juvenile justice involvement, and aggressive behavior. 60% report either being truant, suspended, or expelled from school. 53% reported physical or mental health risk, and 77% of our girls report family instability, such as homelessness, eviction, conflict, or lack of supervision. Post-PACE, 94% report an improvement in their relationships with parents, peers, and teachers. 80% of our girls improve their own self-efficacy, so how they can handle a problem on their own. This session, we are asking for an additional $225,000 in recurring funding to maintain and expand our services. The funding that we're requesting would allow us to serve around 60 additional girls per year and expand into all middle and high schools in Bibb County. The average amount of time our girls are spending in the program has increased from 9 months to 11 months, so this funding would not only allow us to serve additional girls, but also to serve our current girls longer. Thank you for allowing me to speak today. We would not be able to serve our girls without y'all, so thank you for everything you do, and I'm happy to answer any questions.
Okay, let's start with Chairman Mathiat.
Thank you, Chair Lady. We love this program, you know that. Can you speak to once the girls graduate from high school, do you track them after that to see where they are, like in a year or 5 years, or how do you do that?
So they don't necessarily leave when they graduate. Our average age is 15, so that's kind of when they usually come in that transition from middle to high school. After they transition out of the program, we do stay with them for a year, but once a PACE girl, always a PACE girl. That's just the time we definitely spend with them, but I mean, our therapists will keep in touch for years, and last year for PACE Day at the Capitol, we had 2 of our alum who are currently in college. They came back and visited, so we usually stay with the girls for much longer.
So your success rate is what percent? Give me an idea. 90% of the girls that graduate or get through the PACE program, and most of them go on to college?
They'll go on to college, not necessarily college, or get a job. I mean, everything is kind of different paths for everybody, but we have, a high success rate of them finishing high school, which is part of our huge priority. Right. Is getting them to stay in school, actually attend school is a lot of our issues that they come to us with. So we do have a high success rate with finishing high school and then going on to be successful.
That's what I was looking for, what that percentage was. Thank you.
Representative Glaze.
Thank you again. I just heard about the program over a year ago and continue to hear great things about what you're doing. I would like some data points if you would help me with that. How long is the average time for a young lady to stay in the program?
So originally last year it was 9 months. Now we've increased that to 11. We're just finding that they are coming to us with additional traumas or not having a positive role model, and they are needing some additional time with us. So we're seeing around 11 months. It could be 3 years. It could be 4 months. It's very individual based on the girl's needs. But right now we're about 11 months per girl.
And what was the capacity of girls you served in 2025?
So We served 100 girls in 2025. We don't transition in and out at the same time, so we're kind of always having girls coming in and out. It just depends on what their needs are. For the year, we saw around 100 girls, and we would like to increase that this year, of course, and get into additional schools.
And for those young ladies who were seniors or juniors, do you know what the graduation rate, actual rate was for your 100 girls? Based on 11th and 12th
Do
grade?
not know that number, but I can get it for you.
Okay. And then, last but not least, do you have data on access points? Like when a kid goes through 12th grade, what are the access points that you guys are pointing them to for skill-based training and or marketplace opportunities?
I can get the specific data for you from the program. I don't have it off the top of my head, but I can get you some numbers.
So outcomes are the most important, and so those outcomes continue to help us know if we're moving along with some of the K through 12 concerns that we have, learning, safety, and literacy. So I'd love to get some data points around those, and then what the outcomes are. And I'll say this, I'm growing up in a very impoverished neighborhood with impoverished parents. I do know when you stay with them and give them access points, you open the doors for them to move from poverty and to also help their family members. So it's like a family effect. You may serve one young lady, but one young lady brings those same traits back to her family, younger siblings, and so you guys have a much wider effect when you have this one-on-one model.
Yes, and we don't just meet with the girls, we do also meet with the families once a month, so we do like to bring them involved.
Thank you. You serve them how many hours in a week or how many hours in a month?
2 per week.
Okay. Thank you again. All your work.
Any other questions or comments? Not seeing any. How many are currently in the program? Is it about that 100? Is that kind of where you stay? And is it high school and middle school both?
It is. We're mainly at 15 right now. We see overall, because we're in Florida too, overall we see 14, 15 everywhere is pretty much where we're getting them a lot. That transition is really tough from middle school to high school.
Sure.
But as young as 11 and up to 17.
Okay. That's great. Well, keep doing what you're doing, Allie. Appreciate you so much. And thank you for being here with us to update us.
Thank you so much.
Good to see you.
Thank you. Good to see you.
Next is Jen King with Georgia CASA. Maybe Marcy Smith also with Cherokee.
Good afternoon, Chairman Dempsey and members of the committee. I'm Jen King from Georgia CASA, and I proudly represent more than 2,700 advocates that are working and advocating for children who are experiencing foster care. I have with me today is Marcy Smith, who's the Executive Director for the Children's Haven, home of CASA Cherokee. And so I'll share a little bit about where we are today and our ask, but I really want for you to be able to hear from Marcy and the work that they're doing there in Cherokee County. So in fiscal year 24, we presented this committee and our entire state network and all of our funders with a strategy that we would focus and invest in our highest need areas across the state. These are service areas, counties that had 300 plus children who do not have a CASA volunteer. And so we targeted funding in those areas. All of the state funding goes to fund local staff positions. And so our local staff support, screen, and train CASA volunteers. I know Marcy will share a little bit about that. We had a $2.75 million ask. Today we're here for the final $1 million. That allows us to, again, continue to invest in those high need areas, but also at our high volume areas. Those are our CASA programs that are now serving 300 plus kids and have additional children and volunteers that they can support if they have the staffing to do that. And then also our high potential areas. So we have a few counties in the state that their circumstances are such that they could take on a significant number of referrals from the juvenile court. The remaining 40% of that million is really to support and sustain our network growth and expansion. So all of our CASA programs across the state in all 159 counties. But I want you all often have the opportunity to hear from me. And I hope that you got to hear from some of our CASA advocates today in your local communities. We had some in here earlier who I'm sure headed back to Savannah already, but I'm really proud to have Marcy here and to be able to represent that local perspective about what the state funding means and does for our CASA network.
Good afternoon, Chair Dempsey and members of the committee. My name is Marcy Smith, and I'm the Executive Director of the Children's Haven in Cherokee County. For more than 30 years, our CASA Cherokee program has been serving our community's children who are experiencing foster care. Just a few years ago, Cherokee County had the second highest number of children in foster care for the state of Georgia. Our organization has successfully stewarded resources and strategically expanded services to meet rapidly growing needs in our community. Evidence shows that children who have a CASA volunteer are more likely to spend less time lingering in the foster care system. Children with a CASA also are more likely to show improvements in behavior, academics, and health. For these reasons, we will always continue to advocate for every child in foster care to have a CASA volunteer by their side. Funding makes this possible. 2 years ago, the Children's Haven was fortunate to receive grant funding that allowed us to add an additional staff member. In our unique and effective model, one staff member will oversee 25 to 30 volunteers. These 25 to 30 volunteers could cumulatively serve approximately 90 children a year. The funding that allowed us to add an additional staff member resulted in our program serving 20% more children. Last year, 184 CASA Cherokee volunteers served 545 children. Yet, we still aren't serving all of our county's children in foster care. We aim to tilt the scales of child welfare to ensure better outcomes for kids. And to do that, every child deserves a CASA who will tirelessly advocate for their best interests. On behalf of my colleagues representing the other 46 CASA affiliates across the state, I respectfully ask for your consideration of the $1 million funding ask to complete Georgia CASA's plan to target support for affiliates with the highest need and highest volume. With the current state of child welfare in my own county and in our state, I know that many families who are in crisis are not receiving timely, adequate, or effective services. I fear that a consequence of this current landscape could be children in foster care for longer periods of time, and it could result in more children coming into foster care by this time next year. Our volunteer advocates truly make the difference for these kids. They ensure that their needs are met and that their voices are heard. Only when we have resources to hire exceptional staff do we have the capacity to serve every child in need. Thank you.
So I just want to say thank you for your support, and we're happy to answer any questions that you may have.
Thank you for the work you do. Representative Cameron.
Yeah, I just have a statement. I'm in Walker County, and the CASA office up there, they're on the front lines of everything because we border Tennessee, so there's a lot of bleed over and stuff, and those folks work awful hard, and so we appreciate that.
Thank you. Absolutely. Representative Glaze.
Thank you again. I'm down in South Fulton in North Coweta, and CASA's, it's like a bedroom name. Most of us talk about it and talk about the impact and those who are volunteering. I want to talk about alignment, and I sit on education and higher ed. and we've just put money in the budget around students who are aging out of foster care. How are we aligning that with some of the work you're doing to help get those kids in a stable place after being in DFACS?
My team is really dedicated to serving those children, and so a couple of years ago they put together a new program called Teen Talk, and this is a brainchild of my staff members and our CASA volunteers who are serving those ages of kids that are coming up onto age 18 and beyond. And they are working really hard to find resources and equip our CASA volunteers with knowledge so that they can best support the kids. And we feel like that's something that we can help to do, is to find those resources. A lot of times when our children age out of foster care and the CASA is no longer needed on their case, these volunteers stick by their side, and they kind of shift into a mentor capacity once they're not officially serving as a CASA, which is just an incredible asset to have that positive relationship for these children as they grow up.
Is there a need for us to help make sure that that information gets back to you, like so that you'll know that we've got up to $30,000 per student per year to actually go and do an apprenticeship, go to TCSG or USG, and also they can use some of that money to be able to house themselves, buy food. Is there something that we could bridge that kind of information so when we pass those kinds of laws and put it in the budget, you guys know immediately? Is there a way that maybe we can do that? And I probably should be looking at my chairwoman to see if we could possibly do that. Because we've got great information at the end of our sessions, and maybe if we could get it to you, you would have what are the new budget impacts that would help the babies in CASA.
As an affiliate of Georgia CASA, we have this wonderful network where that information gets streamlined down to us from Jen King and her team. And that is such a blessing to be able to get that information as it happens, so that we've equipped our staff and our volunteers with the right information that they can then share with their CASAs who are directly serving children. So I think that streamline is a unique setup that we have within the Georgia CASA network, that we can rely on them to share that information directly with us as affiliates.
We're happy to share that. I was thinking that I rarely meet a CASA volunteer who isn't providing an update on a child or a young person that they served in their journey beyond 18, and so our CASA volunteers can and do remain connected beyond that point. But that's the whole idea, is having that individualized attention and relationship where they're a trusted adult and that information is being shared directly with the young people. But Marcy's right. We put all kinds of resources and training in the hands of the CASA staff to be able to provide that directly to the volunteers.
Good questions. I know coordination of services is certainly a challenge at all levels of government, but I do believe, I'm aware that you are doing as good a job as anybody could, actually. So y'all continue on. I don't see any more questions or comments at this moment, so I want to thank you. I hope you all did have a good day here today, and that the advocates felt they were heard as well.
They did. We asked them to give one word, and they were all saying that they felt heard, inspired, connected. It was great.
Good.
Yeah.
That's excellent.
Thank
Tireless, unselfish work on everyone's part. So appreciate you very much.
Thank you so much.
Next, we have Tyler Mann, Camilla Miller with the DeKalb County District Attorney's Office.
Good afternoon. My name is Tyler Mann. I'm the Director of Policy and Legislative Affairs with the DeKalb County District Attorney's Office. With me is Camila Miller, who is the Director of the office's UIFSA division. Just so you know, we've given you a packet of information. My presentation will not strictly follow that PowerPoint you have. We're here to ask for $90,732.04 in additional funds for our FY27 UIFSA operations. As I think you've probably heard recently, UIFSA is the Uniform Interstate Family Support Act. It's the federal mechanism by which child support is established, enforced, and collected when the parents live in different states or countries. The state is obligated to provide these services by the Child Support Performance and Incentive Act of 1998. Our office contracts with the state to perform the services on its behalf in DeKalb County. We were here last year making a similar ask for the FY25 supplemental budget. You gave us a partial increase last year, for which we were very grateful, and that full amount carried over to the FY26 budget, but it still left us underfunded and understaffed. Our posture and position are different this year than last year. Last year, we told you we were struggling. The additional funding you approved allowed us to scrape through FY25 and FY26, but now we are finally at our breaking point. There are two issues. The bigger one is the shortfall in funding. The second, which you have no control over, is that we do not receive our contracts from DHS for review until near the end of the calendar year. We don't get reimbursed by the state, the county doesn't, that is, until that contract is finalized, which means that for the majority of the fiscal year, DeKalb County is covering funding without any assurance of reimbursement from the state. Our contract was just finalized for FY26, and DeKalb County has not received any reimbursements. This is not tenable for the county. 2 weeks ago, we informed DHS that we cannot and will not continue like this. If we are not fully funded and are not assured of a timely contract, the DeKalb DA's office will not enter into a new contract to perform the state's UIFSA duties in DeKalb County for FY27. Our employees love what they do and they're good at it. We have approximately 4,200 active cases now affecting approximately 6,000 children. And as of FY25, we collected $9 million on behalf of children in DeKalb County and elsewhere. These employees are not fungible. Many of them have been doing this work for a decade or longer. UIFSA requires expertise because of the complications of handling the laws and regulations of all states and multiple countries. Because of that expertise, our office is used as a statewide resource by other offices with less experience. These are not jobs that can be replaced by technology, which is a laudable budget priority of the governor. These people are experienced and trained and can only be replaced by other people at great cost. We are down 5 people and have been unable to replace them because of our underfunding. The funding gap has crushed morale in our UIFSA department, and it has made it impossible for us to perform to our office's high standard. We can no longer ask our people to continue under these conditions. If we do not enter into an FY27 contract, the state will be obligated to perform the services itself. The state does not have the option not to fill the gap. It is obligated to do so pursuant to the law I referenced earlier. Failing to do so will result in a penalty period, a reduction in funding, and ultimately an obligation of the state to repay federal funds. Adding our request to the FY27 budget will prevent this burden from falling onto the state at a cost of about $90,000 extra. Fixing the problem, if we do not enter into a new contract, will very likely cost the state significantly more than that. Our current state funding is $509,069.54. We are asking for a total for FY27 of $599,801.58. This amount will be double matched by the federal government pursuant to its contract with the state, and our total contract amount, including state and federal funding for FY27, would be $2,784,527.94. Do you have any questions for me or for Ms. Miller?
Thank you, Chairman Mathiak.
Thank you, Chair Lady. Can you run those numbers one more time?
Yes, ma'am.
Thank you.
So the increase we're asking for is $90,732.04, which would make our total state funding for FY27 $599,801.58, and our total contract amount after adding the federal funds would be $2,784,527.94.
Thank you.
Yes, ma'am.
Can I ask one more thing? I just thought of something. We heard this last year.
Yes, ma'am.
The numbers are way bigger this year. What, are you getting paid at all? I mean, let's go back to just the basics.
Mm-hmm.
Are you getting paid at all? Let's start there.
So respectfully, for us, the number is not way bigger. Last year, we requested an increase of,
I think it was 191,000 in state funds.
Okay.
and this year we're asking for 90,000. You heard a presentation, I believe, from other offices, and that number, as Representative Oliver asked about in the presentation, gets those offices up to an FY21 level 6 years ago. We call that pre-pandemic funding. We came on our own last year and made a similar request for that amount, and that's the bump that we were given last year.
Okay.
But I'm sorry.
Did you receive it?
We did.
You did?
We did.
Okay, great. Okay.
But it still left us behind. And so that's why we're here, and we just cannot continue without full funding.
Okay. Thank you.
Yes, ma'am. And to answer the second part of your question, we are getting that amount. And so we haven't been reimbursed this year because our contract comes so late.
Yeah.
But typically DeKalb covers that cost, and then we're reimbursed by the state, and the state's money is matched by the federal government. Double matched. Yes, ma'am.
Representative Cameron.
Why does your contract come so late?
I don't know the answer to that question. It didn't used to happen like that, as I understand it.
So I want to say pre-COVID, because I've been with this office since 2011. Pre-COVID, we probably would get contract initiation documents maybe in November. We have not received contract initiation documents yet this year. And I know, as I understand it, there was a new system in place with the state, and so they were trying to work out the kinks there. I mean, we just were significantly late, and that's what we've been told, is that there was a new system in place. I'm sure, as with everyone else, they have new employees in place as well. It just did not even make it through the system until December.
The whole system used to work different. It used to be that DHS would include all of this money in its presentation.
Right.
And that was significantly more efficient. The other change is that our request for our numbers has come in the last few years after DHS's presentation to the government. So, to the governor, excuse me. So we've been left to make this presentation to you instead of it being included in DHS's presentation, which is a recent change, and puts us in the position of coming here individually to ask you for our funding.
And so there are other people just like you around the metro area?
Yes, sir. So I believe they presented in the FY26 budget, and that number is included. It was included in DHS's presentation earlier. But we all keep in close contact. We have worked together. What happened last year is that we communicated a little about coming together to make a presentation to you, and for various reasons, we were the only ones who decided to go ahead with it, and that's why we came on our own last year. I believe the other offices presented together in the supplement to FY26, which basically accomplished what we were able to accomplish for DeKalb last year, and now we're here asking you for this additional $90,000.
Thank you.
And just so you're aware, there are 9 contract child support offices across the state, which are DA run.
Who have a similar issue.
Yes.
The FY21 money will not meet their needs, as I understand it.
Are most of those right around this area, or are they spread out in the state?
They are spread out throughout the state. I know, I will tell you, Clayton has a UFSA office, Cobb has a UFSA office, and then us. And then we have there are some DA-run offices in Savannah. They don't do just UFSA, they do both in-state cases and UFSA cases. I think Tifton, Pataula, there's a few of us out there, and all of our budgets work a little bit differently.
Because of different contracts between us and the state, and the state and the federal government.
Right.
Representative Glaze.
I hope this doesn't come across ignorant, but I'm not understanding how the system changed and when it changed. And then if that's possible, if funding is coming from here, is there ways that we could possibly identify timelines and timeframes to get contracts inside of our budget so that we can help manage their timeliness of contracts? So I'm just wondering, how do we help? Besides the 90 million that we're gonna, 90,000 that we're gonna put in, how do we then help a standard operating procedure get back to something that's manageable for you guys? Because $9 million is what you guys collect.
Yes, ma'am.
Yes.
So just thinking about if that wasn't there for families, what that would do to children.
Yes, ma'am.
So I'm just trying to think of how do we do that from an accounting or from a budget space. How do we require some timeliness or timeline? Is it even in our purview?
I'm not sure. I mean, I know we've discussed this with the state this year, and I think several offices have, because it really put a lot of us in a bind this year. I mean, and I'm hoping that they understand, from the conversations that we've had, that this really hurt us.
Right. For most of the offices, maybe all of the offices, the prior system worked much better, which is that the offices submitted their actual budget request to DHS prior to DHS's budget meetings with the governor, and DHS included those amounts in its request. Since that time, it's been kind of a two-path process where we submit a reduced number at instruction of DHS. That number goes to the governor, and then we are in a position to later ask for supplemental funding. It leads to an extremely inefficient process that has us worried for most of the year that we're going to end up with insufficient funds to carry out the work we're doing. And it causes great stress for our county commissioners, as you can imagine, that they're making outlays without a guarantee of reimbursement. We've never had outlays not reimbursed, but it is always the condition that if we don't have a contract, we don't have a guarantee that the county will be reimbursed for the funds that it's outlaying for us to perform the services we're performing.
And once again, it sounds like other counties are going through this similar situation, and we haven't heard from them, to my knowledge, not publicly. Okay.
I think that I don't remember each county's individual situation last year. There was a new DA in one county.
Right.
I believe one county thought it was PAC's responsibility to take care of this, which it is not. That's why we came on our own. We talked about coming together, and it didn't work out. We were all together this year. We're all in agreement. There is no disagreement here, but the request to match FY21, which was included in the presentation you saw earlier, doesn't help us. And so at that point, we said, look, we will sit out the supplemental FY26 process, and we'll go again and make an ask for our full funding, which is what we need for FY27. But I don't know numbers for the other offices.
Right. No, and we just appreciate you bringing it to our attention and being here today, making us aware. If you don't ask, there is nothing to build upon. So I thank you for that. I think Representative Chairman Mathiak has a question.
Thank you, Chair Lady. I just thought of something else, or we did. Does this department need to come out from under DHS and be somewhere else?
I don't feel qualified to answer that question.
Yeah, I'm not sure. I know there are several office managers across the state who are part of the contract offices who have been here since the 90s. They could probably answer that question a little bit better. I understand at some point we were kind of a little bit to the side and receiving the federal funds directly through our offices. I'm not sure how that worked way back then. And they would probably be more qualified to answer that question. But I think early in the 90s it might have been a little bit separate. But there is a statute that says we can do this work on behalf of the state.
Gotcha.
Right, and it's that federal statute and the mechanism of contracting with the federal government, the state and federal government, that I don't feel qualified to give you any detail on that process. I would be happy to find out if you'd like me to.
Yeah.
Sure. I'd be happy to look into that.
I do encourage you to look out and send us any more information that you come up with. At the same time, we will too. We'll ask some questions and see what we can do, because this is certainly not a sustainable model for y'all at all. Appreciate you being here.
Thank you very much for your time.
Thank you so much.
Thank you. Thank you so much. So next is Heather Rolls from MAC.
I'm supposed to sit over here. If there's a specific place I'm supposed to sit.
Those chairs don't move very well, do they?
They don't, and they're kind of stuck together a little bit.
Sorry.
That's
Sorry.
Good afternoon. Thank you so much for hearing from me. I am Heather Rolls. I'm the Executive Director of MAC, which is the Multi-Agency Alliance for Children. We're a statewide program. We serve over 1,000 young people who are in foster care every year. And I, first of all, would like to thank you for adding the programs that were cut back in November into the House version of the amended 2026 budget for the out-of-home care special projects programs. I really appreciate that. I came and spoke to you in January, and I know we're very passionate about the work that we've been doing, and we appreciate it. I also wanted to express my appreciation for fully funding the out-of-home care program. I come to you again today to ask for this funding to be addressed in the base budget for FY 2027. Please fully fund, please fully fund the out-of-home care program in FY 27 budget at line item 28116 by including the over $82 million. I want to explain a little bit. I believe that the higher cost in out-of-home care is really I believe that the high rates and the higher costs in out-of-home care reflect actual costs to support youth and families. The out-of-home care budget supports all the services and supports young people and families need to keep youth safe and cared for, and the services range from anything from transportation for family visits, tutoring, foster care, to residential programming, and everything in between. That includes the education services and prevention things, which are some of the services that we had cut back in November. These are all services that help heal children and families so that they can thrive. So I really appreciate your dedication to the youth and foster care and all of the nuances of how it all works together. And so I just want to say thank you. And I'm happy to answer any questions that you may have.
Well, thank you for coming back and spending your afternoon with us.
Sure.
To thank us.
My pleasure.
You know, I do appreciate the information that you've presented at the last hearing, and I'm glad that you see a glimmer of hope ahead.
Yes,
for
we do.
sure.
Thank you.
Are there any questions or comments from the committee? I am not seeing any, so thank you.
I would like to add one more thing, if I may. One of the programs that was cut that we talked a lot about back in January was the education program, and we're really excited to be working with the Fanning Institute for Leadership at UGA and the Embark Research Coalition through UGA to really look at graduation rates for kids in foster care, so that we can really increase the rates of graduation in foster care, so that we can look at post-secondary education and workforce development, so these young people actually have a place to go. And I appreciate all your work on the higher education too. Thank you. All right. Thank you.
Thank you so much. So next is Wayne Noggle with Families for Families, and I believe we all have a handout here as well. I believe so. I believe we did.
All right. Well, first thing I'd like to request is $10,000 to put pads on these chairs back here. So thank you for letting me share. Madam Chair and committee. My name is Wayne Noggle. I'm with Families for Families. I have met with some of you individually, and I look forward to meeting with the rest of you hopefully next week or so. For those who don't know me, my wife and I adopted and fostered and adopted out of Fulton County foster care. We adopted 2 little children that were abandoned. One of them has significant special needs. We adopted her in 2014. She's in a self-contained class, but she's doing well. The other one has some special needs, but mainly she's 13 years old, and we have lots of attitude and stuff to deal with, but she's doing good. And so on the inside cover there, there's a picture of my family. There's my cell phone and email on there if you guys ever have any questions. And so let me just kind of set the stage. So Georgia's 12,289 kids in foster care. I know there's a lot of numbers floating around. This is off the state website. 3,840 of those are placed inside their legal county, which is the best thing for children. 8,499 of those placed outside their legal county. And of those, 7,116 are placed in the region. So the DFACS has about 15 regions in the state. So if we can't keep them in their county, we do love to keep them in their region. 5,173 are placed outside their region. Some of those children are placed hundreds of miles from their birth families. We have some that are placed 200 and 300 miles from their birth families, South Georgia all the way to North Georgia. And that data is pretty available. There's a QR code there. You guys can scan that and go to that website from DHS there and pull that data up, and I'm going to try to update that if y'all keep that book. The next page there is the state of Georgia, and that is the regions that Families for Families served. We came to you guys last year. We had 8 contracts, and we were trying to get a contract for the bottom right corner down there. We call that South Central Georgia. If you look on the next page there are 52 child placement agencies in Georgia, like Families for Families, that hold 104 contracts. So we are one CPA that holds 9 contracts in Georgia now. 28 of those contracts are in Fulton DeKalb County. So we have a lot of CPAs right here in Metro Atlanta. 76 of those contracts serve the other 156 counties, which sounds like there's one child placement agency for every other county. But like in Valdosta, which is Lowndes County, we have 7 contracts in that one county. So the struggle we have in Georgia is we have our CPAs go to where the families are and sometimes where the money is, and the kids are in the rural areas. And so if you look on that chart right there, in Central Georgia, which is like Fulton, DeKalb, Gwinnett, Walton, 2,390 kids, 3.4 million people with 38 child placement agencies. Kids enter a care rate of 6.97 per 10,000. And if you go on the bottom down there, South Central, 1,659 kids, 630,000 people, 8 CPAs, 7 of those being in Lowndes County, and kids enter care at a rate of 26.31 per 10,000. So they enter care at a rate in South Georgia 4.5 times higher than they do in Metro Atlanta. And most people just don't, I don't think they don't care. I think they just don't know. And so we came to you guys last year and asked you guys for $10 a day to help us keep children in their communities so the kids in South Georgia can stay in South Georgia. You guys gave us $250,000 that you awarded to us. We did start that office down in, it's down in Pierce County, and we are serving that area down there. You awarded us that money, I guess, in March or April. We began emailing the department in late June, all through July. We emailed 4 separate emails asking for the money, asking for a contract so we get the money released to us. No response. We never got an email back. We never got a contract. However, we did start the office. That office is up and running, and we are placing children down there. We are now looking at doing an office in Albany with a partnership with Sherwood Baptist Church down there. And so the $250,000 that was being cut today, that was a recommendation, is that $250,000 that you guys gave us last year. However, I think in the amended budget that you guys did put that back in there. And so I want to, like Heather, I want to say thank you for doing that and putting that back in the budget for us. So on the next page there is all of our data from 2026. So we placed 287 kids last year in 2026. 239 of those children were placed outside of Metro Atlanta. So we spend most of our time and resources not working here with all the other CPAs are, but trying to go outside of Metro Atlanta. Since we started in 2017, we've placed 1,432 children and done 217 adoptions. So we've had incredible growth since starting in 2017. On the next page there, I think, is what I want to talk to you for just a few minutes about. In 2024, we placed 186 kids. Last year, we placed 287 kids, which we had a 54% increase in placements. We also, in 2024, we did 76 reunifications. Last year, we did 120, which was a 57% increase in reunifications last year. And partly is that because we're keeping kids close to their birth families. One of the best numbers we have in 2024, we did 40 adoptions, and last year we did 44 adoptions. So while placements went up 54%, reunifications went up 57%, adoptions only went up 10%, which means that children are getting to go home. And that is the best outcome for children. The best family they can go home to is their birth family when it's possible. And through all that, we ended up, the days in care, we went from 351 to 315, so we've reduced all of our days in care by 10% with our children. And I'll share with you some numbers on that in just a minute. And so as we do this, as we start more offices, as we go to rural parts of Georgia, the most profitable thing I could do as I leave Families for Families is to close rural offices, just run offices in Metro Atlanta. The kids would stay in care longer. The state would pay more money in transportation, more money in behavior aids. The kids would stay in care longer, which is better for agencies because we get paid per night. The worst business model we can do is to open more offices up where the kids go home quicker and they stay in care less time. And unfortunately, when kids are placed farther from their birth families, if they can't have transportation, mom and dad get discouraged, and sometimes they fail case plans, and kids go to adoption that maybe didn't have to go to adoption if we could have done weekly visitations and everything with their birth families. So on the next page there, just give you a few points about children in foster care. They're 5 times more likely to experience PTSD than the general population, twice as likely to have PTSD than a veteran of the Iraq or Afghanistan war. The recovery rate from PTSD from children in foster care is 28.2%, while the general population is 47%. 4 times more likely as a U.S. war veteran to attempt suicide, twice as likely to have anxiety disorder, twice as likely to have alcohol dependence, and 7 times more likely to have drug dependence than the general population. And so some of the things that help and hurt with this is how long the children are in care, if they're placed with their siblings, and the amount of times they get to see their birth families while they're in foster care. The Congress in 2018 did a report that 75% of children placed within 20 miles of their birth families went home within 12 months. And the same study also showed that every additional mile, weekly visitations decreased by 10%, which means kids stay in care longer, they have more issues when they go home, and then we deal with them as adults with mental health issues, jail, and all that kind of stuff. And so on the next page there, and then I have one more page for the ask, is in Georgia, our kids stay an average of care of 24.4 months. At Families for Families, they stay an average of 10.3 months. Since we started doing this in 2021, our kids were staying in care about 431 days. Last year, we got that number down to 315 days. And so almost every year, we've seen those numbers drop. And so let me show you this by the numbers. The state pays child placement agencies, the lowest rate they pay is $65.14 a day, all the way up to $196 per day. If we take the lowest rate they pay at $65.14, and then daycare is about $160 a week through CAPS, and divide that by 7, it's $22.86 a day. If they do one visit a week that's very close for $100, most visits, most kids see their families sometimes twice a week, and sometimes that number is $200 and $300. So this is the absolute lowest rate the state would pay. If our kids go home 115 days quicker, which they've done over the last 5 years, it saves the state $3.5 million at the lowest rate. And that number is probably much, much higher than that. If we look at and that's the Families for Families data, if we look at the state average, our kids are going home 420 days sooner at the lowest rate they pay, saves $12.8 million, and that's per year. So I think all the data says the kids go home quicker, it's better on the kids, it's better on our budget for everything that we do. So on the last page is my ask, and I'm not going to read all this to you. But our ask is, if we have about 300 children in care at $10 a day for 365 days is right at $1.1 million. And that helps us run rural offices. It helps us staff to what the state requires us to have staff, helps us to rent space. We do a lot of support for our foster families. Over half the families that go into foster care quit within the first year. So far this year, we've held a 92% retention rate of our foster families, and that comes through mom's nights and dad's nights and date nights and cars and cribs and all the stuff that we do for our families. We are not asking for this as a lump sum. We're asking this for $10 a day. So if Families for Families does not place kids like we say we're going to, we don't get like a lump sum of $1 million and we can just go do what we want to. $10 a day, and then we take that money down per month for the placement. And I'll just say this, I think it's important to say that whatever you guys decide to give us, if we don't have language that we get a contract, it doesn't matter, because if the state doesn't issue us a contract, it doesn't matter what number you throw on it, we won't get the money. So that is my presentation.
Thank you so much. Thank you for the good work you're doing. Are there any questions or comments from the committee? Representative Glaze.
Well, it's such a breath of fresh air to hear the amount of work that you've done and to move the average days of care from starting in 2021 from 431 down to 315. That kind of work is just admirable, and we can't thank you enough. I am just trying to figure out then, how do we get you a contract so that you don't lack another year of going without the support that's already there in the budget. So I don't know like the intricacies, but that has to happen or you can't do your job. And the work that you're done is here in the numbers and the percentages. I just hope that we can do the right thing and figure out how to help
Thank you.
You get your money in a timely manner to take care of the children.
Thank you.
I don't see any others, but I hope you know how much you are appreciated. Those numbers are pretty amazing.
Thank you.
That there could be that much success in it. So I know you will, but I encourage you to persevere, and we'll see what we can do on this end.
We appreciate all you guys do, and thank y'all for meeting with me and letting me come in your offices all the time. So
thank you.
I'll
Keep
see some of
sharing
you
your
next week.
stories. They are wonderful.
Thank you.
So next we have Abigail Garcia with Shepherd Center and Share. And Gary, I think it's...
Is it okay if I...
Yeah. Yeah, y'all wherever you want to be, please.
Okay.
Yeah.
Well, and thank y'all for, I know it's late in the day, and
we'll try to keep it brief, but appreciate your attention and patience. Good afternoon, Madam Chair and members of the subcommittee. My name's Abigail Garcia, and I'm Director of Government Relations and Advocacy for the Shepherd Center. I'm here to request $1 million in the fiscal year 2027 budget to support the Share Military Initiative at Shepherd Center, a nationally recognized program that serves veterans, active duty service members, and first responders. SHARE stands for Support, Hope, Assistance, Recovery, and Education, and that's exactly what this program delivers. SHARE provides specialized, evidence-based care for individuals with traumatic brain injury, along with PTSD and substance use disorders. What makes SHARE different is its focus on TBI, traumatic brain injury, and its interdisciplinary, individualized approach that doesn't stop at therapy but helps people successfully transition back to their families, communities, and workforce. Since 2008, SHARE has served more than 850 veterans. I think that number is actually closer to 900. And the program consistently has a wait list of at least 100 eligible veterans. Absolutely no veteran, active duty service member, or first responder treated at SHARE ever comes out of pocket for any cost. And because we can provide housing, we're able to serve veterans and service members from rural parts of the state. SHARE's annual operating costs are about $4.7 million. and roughly 77% of those costs are for non-billable services such as intensive therapy, housing, case management, peer support, and transition planning. Insurance reimbursement is limited, only about $402,000 collected on 3.7 million billed. So that's about 11% reimbursement that we're getting, largely due to low VA and TRICARE reimbursement rates. As a result, the program relies heavily on philanthropy to survive, which is about 85 to 89% of our cost. A $1 million state investment would make a meaningful difference. It would cover roughly 20% of the annual program cost and allow SHARE to expand capacity and help reduce the wait list. Just as important, state support would strengthen donor confidence and stabilize the program, signaling that Georgia is a true partner in caring for those who have served. Lastly, we do have a letter of support for this request from the House Chairman of Defense and Veteran Affairs Committee, who was able to tour in the interim and see firsthand the intensive service and treatments that we are able to provide. At this time, I'd like to introduce Gary Herber, a SHARE alum, who will briefly speak to his experience and impact the program's had on his life.
Thank you for having me today. My name is Gary Herber. I'm a generational Georgian. My mother's family goes back before Atlanta was even the capital. In 2007, I joined the United States Army, and in 2009 deployed into a war zone in eastern Afghanistan. I can tell you a lot more about that, but I'm going to keep things brief because my war really happened on the backside of that deployment. During that deployment, the 25 men on my team, the Death Dealers team out of upstate New York, encountered 13 IEDs in that summer. Every single one of my friends was impacted in one way or another. Many lost limbs, many came home from that deployment early because of neurological and trauma, and myself came home. I actually finished that deployment, but came home in early 2010 to a traumatic brain injury that went underdiagnosed or misdiagnosed for several years. My career was cut short. I actually got blown up the day after I re-enlisted. I planned on being in the Army forever. After 4 years, I had already made sergeant and was just on my way towards a career serving this country that I love so much. After the traumatic brain injury, my career was cut short. I was forced into a medical retirement in 2012, and not only lost my job, but really lost my way in life. I was going through the VA healthcare system. I was doing all the right things. I felt as if I was doing all the right things, but as we heard earlier about the hardships of being a caregiver, I never saw myself being able to live without someone that was going to have to really help take care of me for the rest of my life. My first suicide attempt happened less than a year after returning home, and over the next 3 years, I lost 4 of those 25 men and women that I served with to overdose and to their own hand. But for the grace of God and fast-acting first responders, I would have been the 5th. Since then, we've lost 2 more of those guys. We came home from a war zone, and many of us created a war zone inside of our own homes. I was one of those guys. I was fortunate enough to receive care at the Shepherd Center in 2016. When I showed up there, I was taking over 30 pills a day. I was on 16 or 18 different medications. I had been through inpatient treatment. I'd been through outpatient treatment. I had been all over the eastern United States trying to find relief. Shepherd Center was able to offer actually a non-surgical treatment that was not eligible by TRICARE or was not offered by the VA. And they were able to help me not just, they didn't just diagnose the problems that I was having, but they helped treat that in a medical fashion, but then also spent the next 14 weeks with me going through their program in setting up a foundation that I could build the rest of my life on. And I'm proud to say that 2 years after graduating the program, I was off of all controlled medications. I had spent the better part of a decade just a shell of myself, and I was able to graduate in late 2016 from the SHARE initiative at the Shepherd Center, a brand new person. I'm proud to say that in the last 10 years almost, since graduating from that program, I've achieved every single goal that I made while I was there. I've set loftier goals and achieved those as well, and I'm proud to say that I'm proud of me. Now I work with the Shepherd Center on a volunteer basis, and this year I will probably travel to 12 or 15 different cities around this country, sharing a message of hope for my fellow veterans and letting them know that there's life-saving treatment free of cost. All they have to do is identify themselves. We can get them to Atlanta, and we can get them the help that they need so that they can go home and be, just as I am, a productive member of my society and my community, but also a valued member of my family. So thank you so much for your consideration and giving me the opportunity to speak to you today.
Thank you for sharing your story. It's powerful. Appreciate it.
Yes, ma'am.
Thank you, Gary. So just in closing, again, we are seeking $1 million in the fiscal year 2027 budget. This would be SHARE does not receive any state support currently. So like I said, we're able to do our mission annually based on philanthropic contributions, which we are so grateful for. So being included as an add-on in the baseline would just do tremendous amount of work for the operation of our program. And I do want to acknowledge we are very grateful. We were included in the amended fiscal year 2026 budget. So hopefully that stays. And again, we're grateful for y'all's action already on that. And we're just respectfully asking that y'all would favorably view this $1 million add to the budget. Happy to answer any questions, or for Gary.
Do you have any questions or comments? Did a great job.
Thank you so much.
We've got one. Or some glaze.
I actually can't sit here and not say that, Gary, you just shared your life story. It is amazing. It's great to hear such a wonderful story. And it's so much your desire. That heart brought you through, but that program gave you the tools. And so thank you for sharing that story. It's good to see a life well lived because you have the tools and the support. Thank you for sharing.
Thank you.
Thank you.
It was my honor.
Absolutely. Thank you for your service. And thank you for all that Shepherd is doing in so many ways and places for so many people. It was a privilege for us to put a little in there for this last budget, and we'll go forward, see what we can do. Thank
Lives
you.
will be changed.
Yes.
Thank you.
Thank you. So I believe Brooke Cubic, DBHDD, perhaps? Yes. And Mr. Miller looks like he will be accompanying her.
Good afternoon, Madam Chairperson and members of the subcommittee. Thank you so much for allowing me the opportunity to speak with you briefly today, especially since I know that you'll be seeing us again next week and you might be getting tired of us. But Charlie is giving you guys a handout that I know you're going to wonder why I'm here speaking, but I wanted to present this to you all before we met next week at our budget hearing, just because I think you might have some questions and you might want to go back and thoughtfully go through it and consider before we meet. So once again, my name is Brooke Kubik, and I am here on behalf of the Georgia Council on Developmental Disabilities to respectfully urge funding for 1,217 now and comp waivers. And this request is based on DBHDD's own internal data analysis and a unified work group process, which I was a very big part of.
I sat on a subcommittee for a little over a year. I still sit on that subcommittee, where we changed the assessment tool for the Medicaid waiver program, and we recreated a new urgent criteria list that is, I think, going to be very instrumental in paring down the wait list to those that really do urgently need that waiver. As you know, Georgia currently has approximately 7,900 individuals on the combined now comp waiting list. Of those individuals, and you can see on the first page of the handout, of those individuals, 1,311 individuals were identified by DBHDD in August of 2025 as urgent. And after applying this new revised urgency criteria, DBHDD, along with the subcommittees, identified 1,678 individuals as urgent. When you adjust that number for attrition and anticipated turnover, that is a calculated need of 1,217 new waivers for FY27. They're not new eligibility expansions. These are individuals that have already met Georgia's strict eligibility criteria. And believe me, when I say that we have strict eligibility criteria, when you compare Georgia to other states, surrounding states, our criteria is by far more strict. These individuals are at risk of institutionalization, homelessness, loss of caregivers, medical crisis, among many other things. So when you look at these tables, the very first page is, you can see that approved, there are 328 individuals that are identified as needing a waiver. And this is straight from DBHDD's data. This is data that was shared using our, in our subgroup. This is data that can be found on their audit and their website. But there's no available staff to process those waivers, which has been another issue, right? So you can add waivers, but without staffing to process, then that won't, that will be useless. There are 410 people aging out of school. There are 50 that are aging out of GAP services and state plan autism services. There are 255 individuals that are 60 and over, and after our revised data on our urgency list, we identified as 60 and over as meeting an urgent need because the older you get, the more services that you will need, and the more at risk you become of going into medical crisis. Other urgency criteria, we calculated 449 after using that list. And then, of course, estimate of emergencies, which is unknown to their system, is approximately 150. There will be 36 individuals that are transitioning from state hospitals in Gracewood. So that gives you a total number of 1,678. Now, if you look at the next page, after identifying those 1,678 people as having urgent needs, DBHDD then subtracted their estimated yearly attrition from the wait list. So they estimate yearly attrition at a rate of about 3.7%. Moving out of state, there's about 61 people removed from the wait list, and it goes through this. So 50 people, sorry. When you calculate all of the rate of attrition together, the average number, and it could be more and it could be less, is around approximately 400 people leaving waiver services every year. And again, that is due to death or nursing home admissions, et cetera. When you take that number and then subtract that gives you 1,217 new waivers that are needed for fiscal year 2027. So when we present our data to you next week, and you will see this again, this number did not come from advocates. It is a very credible number. It came straight from DBHDD's structured internal analysis. It came from our reconvened planning list work groups, which were made up of cross-agency collaborations, experts in the fields. And it was a strategy that was agreed upon unanimously by work group members. We were told that there would be a unified ask, and the unified request was agreed to at January 12th of 2026 at a work group meeting with members of DBHDD, and among other subgroup members. Additionally, with the addition of needing 1,217 new waivers, DBHDD then determined that they needed 26 additional staff to process and oversee the increased waiver volume. And that would be at a cost of approximately $2.5 million yearly. Without adequate staffing, funded waivers cannot be implemented efficiently or accountably. So this request is not only a human issue, it's a fiscal issue. The average now waiver costs approximately $16,222, and the average comp waiver costs approximately $104,000. By comparison, Georgia has spent $19 million from fiscal year 21 to 25, keeping 570 individuals institutionalized. When you look at the community-based waivers, they cost much less than institutional care. It is much cheaper to keep someone in their home than to keep someone in an institution. Reduced ER and crisis system utilization goes down. You leverage federal Medicaid match dollars, and you decrease long-term system strain. If you fail to fund urgent need, then that shifts cost into hospitals, crisis stabilization units, law enforcement, and then state-funded institutional settings, which will drive cost up significantly. Those systems are much more expensive and much less humane. Failure to act will likely result in, for these 1,217 individuals, increased institutionalization placements, greater emergency system strain, and our emergency systems are already strained, continued caregiver collapse, and legal and fiscal risk under Olmstead and the United States versus the Georgia Settlement Agreement. This is a data-driven request. You will see it again next week. I really appreciate you allowing me to present it to you briefly today. It is aligned with DBHD's own analysis. It does reflect urgent need among Georgians who already qualify. So, in conclusion, we respectfully urge the subcommittee to fund or consider funding 1,217 new now in comp waivers and 26 new DBHDD staff positions. Thank you so much for your time and your consideration. I truly appreciate it. And if you have any questions, please feel free to ask myself or Charlie.
Okay, Representative Glaze.
Thank you so much for the work that was put in to find and get us the finite number of where the urgent need was. And I read that you guys were going to be doing that. I'm so glad that you came now to give us direct information. This took a lot of cross and sectionality between all of you experts to get here. I don't want this to be wasted. I want this to be targeted. So can you give us the numbers, the actual numbers? Of course, we got 1217 is the request. What does that translate to in total dollars? And then the 26 personnel needed, what does that?
So the 26 personnel, additional staff is about 2.5 million. The actual number for the 1,217, I know that there are numbers. Hang on. To my rescue. Okay. So, and I will be happy. I have more of these in my briefcase. I will give them to you. But 1,217 new waivers would be approximately 129 million. And of course, that number could change because each waiver is, depending on if it is a now waiver or a comp waiver. And so that's just a rough estimate. And the 26 new DBHDD employees do equal to 2.5 million. Right now, with the number of employees that DBHDD does have, they have shared that they can process approximately 1,000 waivers. But if you add those additional waivers, then you have to add 26 more, and that comes in like planning list administrators, psychiatrists, and so forth. So there's lots of we have it broken down. They actually broke it in our committee when we were talking about this, because our first ask was to revise that tool and then to really get a real number instead of doing a guesstimate of, I think we need 2,500. Because it's very important fiscally to be responsible to the state and to get an actual number to the best of everyone's ability. And I'm very proud of this new urgency criteria tool. I mean, I can say that I did work on that, and so I'm really proud of that. And the good thing that it does, for the first time ever, I believe, it takes as much subjectivity out of looking at who is truly urgent than any other tool we've had in the past. I do know that they have contacted Ralston Institute, and that Ralston will be validating that tool and that data. I also know that they can do a linear validation. So, and that is what they did. So they went back and did a linear validation, looking at these with their old tool versus their new tool. And that's what we came to. And it's so confusing. It gets confusing to me too, because, I'm not in their system per se, so I'm not seeing everything, but I do understand data and science. And so I felt very comfortable with this 1,217. Unfortunately, that was not the ask that was presented in the budget. And I believe it was simply because our subcommittees there were 3 subcommittees, and 2 of them now have been collapsed into one. But our subcommittees could not finish that work by August, which is when Commissioner Tanner needed that data. And so, at the time, he was going off of old data and did not feel comfortable asking. Now, he, I believe, would feel comfortable asking for this. So I hope that answered your question. I'm very sorry.
Any other questions or comments? I'm not seeing any, but I do realize how hard you worked and how much time was spent trying to gather this and give us this vision. So I thank you for that. It's good to have it, and it sounds like you'll be back with us again next Wednesday when we convene again. We'll look forward to that. Any other?
I'm with Cobb's, the East office, and I would just mirror exactly what the CAB had to say.
Okay.
We are in a massive shortfall. We did about $10 million last year in collections. These are for families that are desperately in need of it. Cobb is subsidizing the state agency about $400,000 a year, give or take, to get us between the end of the state money and the start of the new state money each year. So we really would appreciate any consideration for that. It hasn't been asked for in years, and we suffered a 14% cut in 2021. I guess it was a COVID-related cut. We took office about a year ago last January, so we're digging in and trying to figure out how best to alleviate this. I'll be happy to come back and speak next Wednesday or speak with you individually.
Dude, that will be great. That'll be great. We'll look forward to hearing more from you.
I appreciate it.
On it. Thank you for being here with us all afternoon too.
Absolutely. It's been a while since I've seen most of you.
I know. Thank you. Not seeing any other speakers. Anything else from the committee? I thank y'all for hanging in and helping us begin to work through this process, and we will come back next Wednesday and try to listen more. Appreciate it. Y'all have a good weekend. Thank you. We are adjourned.